greater than 36 make a GI bleed highly likely as blood is digested and reabsorbed as urea. FFP may be given for coagulopathy due to warfarin therapy, liver disease, or iatrogenic dilution of coagulation factors from multiple blood transfusions. Uremia may cause platelet dysfunction, particularly in patients with renal disease, and can be treated with DDAVP. An NG tube is often placed in cases of upper GI bleeding and may assist in diagnosis of GI bleeding if large volumes of blood are returned. No blood return does not rule out a GI bleed, however. Proton pump inhibitors should also be started, which decreases the acidity of the GI tract, helping to stabilize clot formation. Definitive diagnosis is made with EGD, where you can see either ulcers, which may be treated with electrocautery or placement of hemoclips, or diffuse petechial hemorrhage and erosions throughout the stomach in the case of acute erosive gastropathy, in which case treatment is more difficult. If EGD fails to identify a bleeding source, colonoscopy should be performed to rule out lower GI bleeding. If both of those fail and the patient is relatively stable, video capsule enteroscopy may be performed to evaluate the small bowel for bleeding. However, this can take 12 to 24 hours or even longer. So if a patient is unstable, angiography should be the next test of choice, where bleeding can be identified and treated with coils or injection of vasoconstricting agent. If all else fails, which is really quite rare, surgery can be undertaken. The type of surgery depends on the cause of bleeding. Duodenal ulcers that are bleeding may have ligation of the gastroduodenal artery with vagotomy for reduction of acid. Gastric bleeding ulcers may undergo distal antrectomy with vagotomy. Acute hemorrhagic erosive gastropathy may be exceedingly difficult to treat and may require subtotal or even total gastrectomy. Well, I'm gonna go check on Oh God, the genetically modified organisms that don't exist in government records anywhere have gotten loose. Everyone, run for your lives!